Morning to you. We just heard there on one of the front pages, 2/3 of cancer targets in NHS England to be scrapped. Do you think that's the right thing to do?
So this is an announcement due to be made following a consultation. This is not something that the government has led on, but it's NHS England, it's senior oncologists, it's clinicians, and indeed cancer charities have called for this change. No targets are actually being scrapped. They're being merged into 3 targets, which I think, and people, all of those experts and specialists are saying, is the right thing to do, focusing on outcomes and cutting down bureaucracy for clinicians.
And you say they've been informed by experts, but scrapping the targets for patients, for example, that want to see a specialist within 2 weeks, may make people feel like they're getting a weaker service and that it's failed.
I think NHS England and oncologists take a different view, and they actually think by moving to 3 targets, including the faster diagnosis standard, it means that actually people will get a faster diagnosis as a result. As I say, this is not something we're leading on, and actually this is something that the NHS in Wales did back in 2018.
It's not all oncologists, though. Professor Pat Price, the chairman of the cancer charity Radiotherapy UK, he has said failure is failure, however you measure it, and that we're facing our biggest cancer crisis in the UK.
Well, we're making significant progress, but yes, there are still backlogs, and we're working hard on that. But if you look at cancer referrals are significantly up, the number of checks up 28% since pre-pandemic. So yes, there are challenges, but we are working at pace, focusing on cancer, faster diagnosis, screening, teledermatology, and fit testing, and all sorts of other areas to get diagnosis faster, because we know how important it is that we diagnose at stage 1 and 2.
The government wants us to talk about health this week. You were very much focused on small boats last week. It certainly didn't seem a success in terms of the messaging that a lot of people felt last week. Why do you think that the Health Week is going to be a success?
Well, every week for me is Health Week. And I think it's important we highlight to the public some of the challenges we face, but also the steps we're taking. So, for example, the announcement today, an extra £250 million of capital funding into 30 trusts to increase the bed base by 900 as part of a wider plan ahead of this winter to increase the number of general and acute beds across our hospitals by 5,000 and an additional virtual ward beds by 3,000, taking the total up to 10,000. So it's important that we do have these conversations and we tell the public and have the conversations about the steps that we're taking, but also some of the ways that they can help us too.
How did you pick these trusts? Because, some people have looked at them and said it does seem that the government is rather favouring trusts in marginal seats. Are you just using health provision as an electoral sweetener?
Oh, absolutely not. So NHS England have set the criteria. So it's all about their ability to deliver by this winter. It's about need, and it's also about their ability to staff. So every single trust will have a slightly different plan. Some will be beds, some will be modular units, like Northwick Park, for example, a new ward. And others will be looking at SDEC, which is their same-day emergency care. Others will be investing their urgent treatment centres. But every single region across the across England, will be getting this investment. But this is only just one part of the urgent and emergency care recovery plan. Actually, it's about 5,000 additional beds. This is just 900 ahead of this winter.
But the problem isn't beds, is it? If you talk to doctors about the situations that they're facing and the trouble that they're having getting people through hospitals, it's not the actual physical beds, it's the staff to run those beds. This doesn't tackle that, does it? Just providing more beds in hospitals won't get more people seen.
It does. So the £250 million is specifically for the 900 additional beds, but actually the £1 billion announced in January as part of the urgent and emergency care recovery plan includes revenue funding for each of those 30 trusts around staffing. Let's not forget, over the past, since last year, we've had an additional 6,000 doctors, 15,000 nurses, and each of those trusts will get funding. They've set out plans about staffing those beds. So they're not just about beds, it's about staff beds in all of those trusts.
But what about funding? Junior doctors still on strike. The round of strikes, latest round of strikes finished today. You've got consultants striking at the end of the month. Isn't that what you should be focusing on? Getting these people who are well trained and are part of the NHS back to work and actually back to staffing these beds?
Well, it's hugely disappointing that both junior doctors, as part of the BMA, and the consultants are still taking industrial action. And that's despite the government having accepted in full the recommendations of the independent pay review body. So take junior doctors, for example. We accepted the recommendation, which is an average of 8.8% or 10.3% for new doctors just starting out in training. So I hope, and the Prime Minister has been really clear, that the discussion on pay is now closed. We've accepted those recommendations in full. My door remains open to discuss other issues around working environments and conditions, but pay is closed, and I think that's the right decision.
It's not the right decision if it discourages people from going into the profession, isn't it? And, you know, if people don't see it as a career that is worthwhile financially, it's going to discourage youngsters from following in the footsteps of these doctors and nurses, and it's storing up huge problems down the line.
And I certainly understand that case, but of course we do have significant numbers of people wanting to be medics and nurses. We have an increase this year, I believe.
Why do you think there's such enormous staff shortages then, if everybody's so desperately keen to do it and it's such a fabulously paid job?
Well, we have more people wanting to be medics and go to medical school every year, and indeed nursing and midwifery, than we have places for. That's why, as part of the long-term workforce plan, we're investing in doubling the number of medical school places. We're increasing nursing and midwifery places back by 2.3 billion. But let's not forget, since this time last year, we've got an extra 6,000 doctors and 15,000 nurses. But of course, every single bed we create, so these 5,000 beds we're creating, need to be staffed. So there will always be that additional requirement for staff. And as a result, we have record numbers of staff working within the NHS. But coming back to your fundamental point, people do want to work within the NHS. And I think if you look at the latest applications to nursing and midwifery, I think it's somewhere in the region of 26,000, far more in excess than the number of places that are available.
Let's move on to immigration and what's happened over the last few days. Lots of confusion about what's happening with the Bibi Stockholm. When the Home Office got the Council's Legionella test results, do you feel that the Home Office is on top of this issue?
Yes, I think they are. And if you, the facts as I understand them, ministers found out on Thursday evening, and then a decision was immediately taken to disembark those who were on the Bibi Stockholm. And it's important that we should always prioritise public health. That is without question. But that is now being addressed, and I hope that we will be able to in the coming days address that issue, and then people will be able to embark back onto the Bibi Stockholm.
If you prioritise public health, as you say, why not wait for the results to come through before you start putting people on the barge?
Well, I think Jenny Harries of UK HSA set out exactly how routine that process is. It's very commonplace that those checks would be undertaken. I don't know the exact detail, and no doubt the Home Office, alongside their contractors, will want to look at the timeline of that. But what I do know, as soon as ministers were made aware, an immediate decision was taken to disembark on public health grounds. And I know that there won't be anyone going on to the Bibi Stockholm until it's totally safe.
It's been reported today that the EU has rejected Britain's attempts to create a new migrant returns agreement. This is a centre point of Rishi Sunak's plans to tackle migration in the UK. He's not going to be able to send small boat migrants back to France, is he, as he would like to? What does he do now?
Well, I saw that on the front pages, and it was a bit vague as to the detail there. It looks like a leak of some description. But actually, if you look at this...
It's a leak the EU have told, a European Commission official has told Britain's National Security Advisor that it's not open to a new readmission deal. Yeah, but it seems quite clear.
Well, if you look at the steps that the UK government is taking around agreements with Turkey, for example, around tackling some of the criminal gangs and the organised criminal activity that encourages people traffic across Europe and then over to the United Kingdom. If you look at our agreement with France, which has seen around 33,000 reduction last year, a 40% reduction, despite, in fact, the numbers coming across into Europe being up by some 30%. Our agreement with Albania, which has seen a 90% reduction in Albanians crossing the Channel. Now, these are just part of a number of steps alongside the Bibi Stockholm and our Illegal Immigration Act that we're taking. It is a number of steps. You can't take one in isolation. This is a hugely complex and challenging issue, one the Prime Minister has put as one of his 5 priorities, and I know that he and the Home Secretary are determined to address it and stop the boat.
This is a setback, though, isn't it?
Well, I don't know the detail of this, and you'll understand as a health minister that I won't have been over the detail of any negotiations or discussions with the European Union. But if you look at the arrangements that we do have with Turkey, with Albania, and indeed with the French, they are starting to bear fruit. And then more widely, if you look at the deterrent factor, again, that is making a difference. Of course, we've got more to do. I understand how frustrating it'll be for many of your viewers seeing people across the channel, but action is being taken. Yes, we've got more to do, but we're determined to do it.
Will Quince, Health Minister, thank you very much.